Okay, good afternoon, everybody. This is Dominic Zerlo, and I'm the chair for the Overdose Prevention and Pain Management Council. And we are ready to start our meeting. It does look like we have a quorum here. I will go ahead and just do a roll call real quick of our committee members to make sure that we do. And then once we have done that, we'll go through the agenda. And then continue on from there. So do we have present Monica Rincon-Smith? Okay. Elizabeth Boyce?
Present.
Mackenzie Chase Enriquez?
Here.
Ernie Doyle? Elizabeth Dyer? Thank you. Phil Feudy?
Here.
Leslie Ann Hayes? Melissa Hines? Okay, I do know Steve Jankuski did let me know he would be absent today. Joanna Katzman? Liz LaCouture also is going to be absent today. Andrea Maloney?
Hello, I'm present.
Thank you, Andrea. And hello. Sharon McCracken?
Good afternoon, I'm here.
Thank you, Sharon. Scott McFall?
Present, I'm here.
Good afternoon, Scott. Darcy Pope Wyatt? Okay. Charles Schumacher?
Yeah, good afternoon, I'm here.
Good afternoon, Charles. Thank you. Randall Starling?
Present. Hey, Dominic.
Hello, Randall. Thank you. Brandon Taylor. Oh, and actually, I do believe Brandon said he would be absent for this, unfortunately. Brandon Warwick.
I'm here.
Okay, thank you, Brandon. And Jennifer Weisberg.
I'm here.
Thank you, Jennifer. Okay, and then I am present as well. I do think we have had a couple of people jump in. So I'm going to go through those that I did not hear a response or may have missed. If you are here, please let me know. Monica Rincon-Smith. Ernie Doyle. Leslie Ann Hayes. And Melissa, I did see you here. Melissa Hines? Yep. Oh, there you are, Melissa. Thank you and welcome. And Joanna Katzman. And then Darcy Pope Wyatt. Okay. Well, thank you, everybody. We do have a quorum, so we can get started with the business. And just really quickly, I actually did want to jump the agenda a little bit because we do have a new member on the council, and I would like to introduce them. And while they don't know it, if they would like to say a few words after the introduction, they're welcome to do so. But we did have a few months ago that Neil Bowen had stepped away from HSD. And so the new appointment to the council is Melissa Hines from HSD. And so Melissa, if you'd like to introduce yourself to the council, you've been a presence here for many years. So I don't think you need to really say a whole lot, but if you'd like to say hello and anything in particular, you are free to do so. So
Thanks
Melissa?
so much. Thanks so much, Dominic. Can you hear me?
Yes.
Yeah, good. It's really good to be back at a table with you, Dominic, and everybody. So yes, I'm not sure how long I'll be in the spot. We now have a full director and a deputy directors lined up here at Behavioral Health Services Division, who may step in, but a real honor to be here while I can. And it is ironic. I'm looking at Jennifer, and anyway, I was the like administrative assistant to Landon, I think, when we were holding these a decade ago. So It's amazing, I haven't aged at all in all that time. But anyway, it's great to see you all again. Phil, shout outs all the way around. Thanks for having me. Thank you.
Well, thank you, Melissa, and we do appreciate it. And, definitely we value your thoughts and opinions, as well as, the long history that you have had here with the council. And it is great to see you again. So thank you. Okay, and with that, I will share the agenda. And pardon me for just a moment while I get that up on the screen. So our agenda today is we do have a review of the minutes, which we will do in just a few moments. And then, of course, our new member. And then we do have a couple of presentations. We are lucky enough today to have Justice Brianna Zamora to talk about the New Mexico Supreme Court Commission on Mental Health and Competency. And then Haley Peterson from our Epidemiology and Response Division at Department of Health to provide an update on overdose and mortality data. And then we'll have our subcommittee updates and recommendations, and then any other business. And then we will discuss when our next meeting is. Unless anybody has an objection, is everybody okay with the agenda as is? Okay, great. Thank you. I appreciate the thumbs up, Brandon. Thank you. So I will move to the minutes. Now, the minutes had been posted previously to the meeting invitation and also on the council website. So I'm not going to spend a lot of time showing them on the screen. I just have it here for display purposes, really, more than anything else. But if there are any concerns, questions, or changes, anything in the minutes that need to be changed, I will leave the floor open for a few moments before seeing if we have a motion to accept the minutes. I should also note for anybody who is who's interested, we do put the recording of the meetings onto the council website as well. So if you ever have questions about it, you can always go back and actually watch the recording.
Thank you, Dominic. I motion to accept the minutes as is.
Okay, thank you, Elizabeth. Do I have a second for that?
I'll second work.
Thank you, Brandon. And are there any objections? If there are no objections, we will accept the minutes as they are. If anybody does happen to notice any issues or concerns later, please let me know if there's a typo or anything else, and we'll go ahead and get that fixed. But being as there are no objections, then we will accept the minutes. All right, so our next step is our first presentation with Justice Zamora. Justice Zamora, I did see you on a few moments ago. Are you there?
Yes, I am. Can you hear me?
Yes, indeed, Justice. Thank you very much for being here and being present. Do you have slides that you want to display?
No, I do not. If my staff doesn't do that, it doesn't get done. But I'm happy just to give you a brief overview of what the judiciary's role is, and then as well as the commission in particular, if that's okay.
Absolutely. I just was checking because I realized I hadn't asked if you had slides or not prior to this. So sorry if that felt like I was putting you on the spot.
Not at all. No, thank you. My name's Brianna Zamora. I'm an associate justice on the New Mexico Supreme Court. I've been a member of the judiciary for almost 15 years. The first 10 years were as a trial court judge, both at Metro Court and District Court. And all of that time was in our criminal justice system. I worked with adult criminal cases, which allowed me, of course, to do drug court, Native American Healing to Wellness Court, what we used to call homeless court, where we go over to St. Martin's and hold court. So I'm very passionate about behavioral health and improving our mental health system. particularly how it impacts our cases and the individuals that come in front of us. So when I finally made my way up, it took a while, to the Supreme Court, I was pretty insistent that we needed to have a commission on our Supreme Court that focuses on behavioral health. My colleagues agreed, and a year ago we started the Mental Health and Competency Commission. But it's not just judges and attorneys, thank goodness. We have a voting member with lived experience. We have physicians, we have psychologists, and importantly, we have representatives from all three branches of government. And a lot of folks don't know it. Half of my job is absolutely to hear cases, write opinions, and research the law. The other half is to administer every courthouse in this state, to approve rules that apply to every court and lawyer in the state, to make sure that the training of our judges is what we really need to be training on, and to make sure that you'll have at least one justice assigned to every commission. Because in the end, if there's a statewide project we want to pilot within our courts or anything like that, it's got to get approval of the Supreme Court. So we're very hands-on and we're very directly involved. But luckily, I'm so glad that I didn't realize, I knew there was a need. I didn't realize how much was out there. I actually didn't know about this group at all. It's very impressive, and I didn't know it was created by statute and appointed by the governor in large part. So I wanted to let you all know that we have this commission. We are always looking for new ways to train our judges in all areas of behavioral health. Dr. Warwick presented to, we have an annual conference statewide that requires all of our judges, and it's mandatory. And he presented on medication for opioid use disorder, which was very, very helpful. We're working on piloting projects in our competency cases, which end up being cases that last the longest, and with individuals who stay in our jails and prisons the longest without getting any treatment. They're basically educated to participate in the process. So if there's any interest in collaborating, training, if you think of issues that might benefit from the experience of a judge, because after all, we are in the courtroom day in, and I know I did this for 10 years. We are in there day in and day out, and we have firsthand knowledge about what impacts there are. And I will tell you, the most frustrating thing for me was having someone that clearly had a severe substance use disorder or alcohol use disorder or severe mental illness that was not able to get the level of care that they needed and was not able to be supervised in the way that our justice system currently operates. So knowing just the exchange of information is, I believe, a crucial part. You all have the knowledge that we need. We're law trained. We're not trained in medicine or science or psychology. And so I think the collaboration is really crucial. And just to give you an idea of some of the projects we are doing, we are, there's other states in this nation that have done similar things, but what we're going to do is try to connect those individuals who are severely mentally ill in misdemeanor cases immediately to housing and medication and treatment. We will be launching this pilot next year in 4 jurisdictions. And we are hoping to avoid the need for a forensic evaluation to get the case dismissed, which they are anyways. They're always going to get dismissed if someone's deemed incompetent, and to immediately connect them at the very first setting, the arraignment, with the services they need. We have courthouses in Albuquerque in particular that deal with opioid use. We have drug courts almost statewide, but we're always looking to change. And I think, in my perspective, having worked so long in our criminal justice system, is having it as early on as possible, even before they enter it, if possible. So I'm happy. I don't know if I'm not used to this program, but yes, it does look like there's a chat. I'm happy to put my email address in there. And just like I said, we are very open. Our meetings are also public meetings. And we are happy to have you attend a meeting, be a guest speaker if you're interested in training judges. I know that might not sound too thrilling, but we can be fun at times. That would be wonderful as well. Or if you have other ways we can collaborate, even if it's just the exchange of information, I assure you that that has been invaluable. Our 3 goals of the commission, I thought we were going to try to end world peace because we were a very eager and like-minded group, but it's to end stigma and discrimination, ensure access to services and treatment, and inspire collaborative change across systems. And the voting members, like I said, I think it only has 2 judges. The rest are all different professionals. So that's all I have, unless there's any questions. I'm more than happy to answer it. And thank you again for having me. I really appreciate it.
Oh, thank you, Justice Zamora. I mean, collaborations like this are really what allow us to be able to get work done. And so it would be really great to hear. Let me just go ahead and open it up for questions or comments. Okay, this group is never this quiet.
Uh-oh.
So my question is, so I actually do have a couple of questions for you, Justice Zamora. And really, so especially some of the specialty courts that started out, 20 years ago. And just to give you an idea, I actually worked with several of the judges back in Albuquerque when the very first homeless court started back in 2001, I think it was, or 2, because I was at the time working at Albuquerque Healthcare for the Homeless. And we really saw what an impact that had. And we had an organization that started that was called the FIC, which was about forensic intervention, that included everybody from the courts in Albuquerque to the jail, so MDC, and service providers to really talk about those issues. And it really had a big impact on what was going on at that time and helped to establish services to connect individuals who need it, just like you're trying to do on this broader statewide level. So I guess one of my questions is, you talked a little bit about some of the areas in the larger cities. What about in some of the more rural areas? Do you have connections there? And if not, what kind of support and help do you need to be able to get those?
That has been eye-opening for me. I grew up in Albuquerque. I think Albuquerque is a small city. So, and then as a trial court judge, I would get so frustrated when I didn't have options. And I would ask the social worker from the public defender's office for options. And then I became a justice, and I realized the lack of resources statewide. We need housing resources in the smaller jurisdictions. I can't even find a housing advocate. I think any and all resources are probably needed. Right now, we are looking just for housing champions in 4 jurisdictions. The 2 small ones are Alamogordo and the Ruidoso type area. And then the other one is Las Vegas, New Mexico, Mora, and Santa Rosa. I don't know exactly who drew the judicial districts because sometimes they don't make a lot of sense. But we have been working for the last 6 months to identify folks in those counties. And we purposely piloted 2 small counties and 2 large for the very reason you're suggesting. So any and all resources, including access to medication for opioid use disorder. I think that's something that's probably, I've seen that as well. They just can't, there's not a mobile van. There were individuals who got cases in Albuquerque that lived out of Albuquerque, maybe in Socorro or Grants, and they would drive every single day to get methadone. It blew my mind. So those type of services are always needed, and maybe they're out there. I don't know, but we don't know about them if they are in enough that we should.
Thank you. And we do have a couple more questions. See, I know sometimes it just takes getting that first question going. So we have Phil and then Elizabeth. So Phil.
Hi, Philip Beauty.
currently with Vital Strategies in the Department of Health. But in my previous role as a harm reduction program manager for the Mountain Center in Espanola in Rio Arriba County, I was very interested in replicating or starting essentially one of the homeless courts, particularly that now that's so that we've gotten so much more adept at utilizing tools like Zoom and Teams and other methods to be able to facilitate things like that. But I think I was really moved when I started thinking about that. I was on the group of people, local folks up there that were doing the work to get the LEAD program started up there. And at one of the meetings, the sheriff's department had done an analysis of the Tierra Amarilla County Detention Center and basically discovered when they looked at it that certain way that it was less than 200 individuals that consumed over 90% of their annual budget, and that most of those people were, because they were on the treadmill with that stuff, primarily for nuisance charges and things. And so I couldn't find any evidence that something like that was currently taking place in New Mexico, and I'm wondering if there are in fact some actual, I don't know if we still call them homeless courts, but that model where we could have had something set up, say at our facility, where people are coming and connect people with a representation and a video visit with a judge.
So Albuquerque still has, they call it outreach court now. When I was at Metro Court, it was called homeless court. And it was actually, I used to go to St. Martin's homeless shelter. I switched to being a trial court judge before COVID. So the virtual court hearings seem so weird to me, but people do seem to like them. But I do think there's something about the judge going to the facility that's convenient for the defendants. And so that's what I did. I believe there's also one in Las Cruces. If you have an interest, we have a phenomenal judge in Rio Arriba County. He worked with the LEAD program. He was willing to volunteer his time to even train the officers, and is very passionate about behavioral health. It's Judge Jason Lydiard, and my guess is he would probably be interested in doing that, although he's a district court judge. But I don't see why he wouldn't be willing to take the lead and maybe train the magistrate court judges. I actually think that county would be a good fit for the program. And one thing that model of the homeless court was really the first time where we kind of see the justice system getting involved earlier in cases, because the judge wouldn't see them until, at least when I did it, until they had completed everything they needed. They were supposed to connect with medical services, connect with the services they needed. And it was only then that the judge had interaction, because we really do want to get folks as soon as possible, preferably before they enter, but that's been proven a challenge in Albuquerque, but at least at the first hearing if possible, or early or shortly after.
Yeah, we teamed up with Judge Lydiard. The Mountain Center took over the providing the case management and related services for his drug court program.
Oh.
And yeah, so we have a pretty tight relationship with him. So
good. Well, if you want to connect directly with the magistrates, I don't ever know the relationship between the magistrates and the district judges and how they get along, is because they wouldn't be, I'd be the last to know if they didn't, right? I'm happy to do that. Like I said, we do oversee statewide, and been very hands-on on trying to make programs get implemented. And that I know is a great one. So let us know.
Okay, thank you.
Thank you.
Great. And Elizabeth, go ahead.
Hi, good afternoon, and I will apologize first because I did get pulled away for a moment, so my sincere apologies if you went over this for the time that I was speaking to someone else. But my question is around the plans for that housing. So it sounds fantastic. The challenge that we find here as a healthcare provider with case management in-house and doing a lot of housing things here is that the immediacy of it, right? So waiting lists are long. It is extremely difficult for clients to get in. So I was wondering if there's like a level of immediacy where there could be hotel voucher implemented, or what the plan is to get someone started as soon as possible, because that's our major struggle with our case management clients is just this incredible lag time and the unavailability of housing overall for our clients.
I wish I did have an answer. That's the part where the lawyer in me doesn't know. I know we need it. We are going to have, or try in this pilot project, have court navigators that have to pre-existing, hopefully, relationships with the case management and the housing and things like that. But that's why we want to champion for each of the 4 judicial districts, someone who can hopefully help us locate those places. And I suspect, I don't know, that it might be even more of a challenge in Alamogordo or so
Yeah,
I believe that's our biggest challenge.
Absolutely. And then the other thing tacked on to that is that depending on what some of our clients have in their records, they might not even qualify for the current housing programs. And so then they're entirely out of luck. And no matter the work that we can do with them, there's nothing that we can do with regards to housing because we can't get them into that housing. So the lift is just incredibly unmanageable. And we understand that housing places want to have people who are safe. And so it's a challenge there. But I think that those are parts of the conversation that need to get had, even for hotel vouchers or other things that everyone needs to get housed in some way. And yes, people will occasionally cause problems for themselves, but for their treatment, it's so important.
I agree, and I can create a court program, all day long, every day, and I can deal with the logistics from the courts. But when it comes to treatment providers, services, and housing, which I think is the biggest challenge in my mind, who are willing to take justice-involved individuals, that's where my area of expertise ends, and I have to rely on the experts. And that's why I think this collaboration is so important. I will say we don't do it often because everyone panics when I say this, but the judiciary does take positions on certain legislation because if it affects our court processes, for example, like the competency statute is very directly in effect. We also follow legislation. We were following a lot of the opioid use type legislation last year because, like I said, we have people who are driving hours to get methadone or they don't have anyone available in their communities. So those issues, they come up in our courtrooms all of the time. But any information we can get to improve that process, by all means, let me know, because that is where my expertise stops and my skills stop. And I recognize that. Like I tell you, the frustration I had was begging the social workers, begging whoever was in my courtroom, find me a place. I'm willing to send them, but they can't be on pretrial services. They're not functioning well at that level of care. They need something much more, or they need a place to live. And so I share your absolute concern, and I think it's our biggest obstacle. And I must say at every meeting and every time I talk with our stakeholders there, where's our housing champion? Who's willing to do this? So any information you have would be greatly appreciated, like I said.
Thank you. Michael, you are next.
Excellent. Can you hear me?
Yes.
Yes. Okay. Hi, Justice Zamora. Nice to see you on here. I just wanted to kind of give you an update just to let you know that some of the legislation that passed this last session was to increase Medicaid to cover integrative medicine services such as chiropractic medicine. And it should be starting in January. I'm not as familiar with the court and the drug courts, but that's been my mission in life, or at least the last 10 years. So just kind of wanted to bring that to your attention.
Thank you. I appreciate that. And we do, I know for sure they incorporate acupuncture and probably other things because they have not been a trial court judge for almost 5 years. But I know that's something that they do try to incorporate and are very open to. So good to know. Thank you.
And Jennifer, you're up next.
Hi, thank you. My name's Jennifer and I run a youth treatment program called Serenity Mesa, and we also have housing. So we offer housing for, we primarily serve youth, but with housing, it's very difficult to find housing for youth who are under the age of 18 because they can't sign a lease. So our housing program is 18 to 24. And right now our funding is coming from the city of Albuquerque. So our housing is pretty much limited to the Albuquerque greater area. So please, if you have any referrals, please send them our way. We have permanent supportive housing. So that includes apartment assistance for up to 2 years. So, and we provide case management services, and we work with several different leasing agents here in Albuquerque. And we have had, we've obviously had some issues with clients and have asked not to come back to some apartment complexes, but we also have funding that pays for repairs. And so that's been helpful too. Like if they know that their rent is going to be guaranteed and they also know that any damages that we will pay for, that also helps. But use us as a resource. Thank you, Brandon, for posting our link as well. And then I was just curious if you've seen any movement in more treatment being offered in the jails, and just more than just Suboxone, but if actual quality treatment while people are in jail.
I don't know of any, and in fact, we just getting enough for the jails, just to get enough staff to make sure that they can get the folks to our hearings or get individuals in custody to competency evaluations has been an absolute struggle. I heard their numbers have gone up, but I completely agree with you that that's a huge challenge. But I felt like we were in survival mode during COVID, and then when their computers went down because our hearings were getting delayed and people were sitting there in custody. And at that point, our biggest goal is, can we please, it can be in person, it can be virtual, but can we get them to court so we can do something with this case? But I wholeheartedly agree with you.
Yeah, I hope to see more of that, especially, because, while they're there, it'd be nice if they could get quality treatment, while they're, especially, while they're waiting for their court date or whatever. But thank you, Justice.
Thank you. I appreciate the information. I wrote it down because I also, not my area of expertise, but deal with the children's court commissions within they probably are aware, but if you'd ever come speak at one of the children's court judges meetings, that would be wonderful.
Yeah, I would love to. I'd love to.
Great. Thank you.
So we actually have a couple of people who have put in the chat that they have some information regarding that. So why don't we finish the couple of questions we have, and then we could get a little bit of update on that as far as treatment within the jails and incarcerated settings. So the next person up though with a question was Josh Swatek. Josh?
Yeah, good afternoon, Justice Zamora. And this is more commentary than a question, but and it's direct more towards Elizabeth's question as well about availability of housing. I do know for a fact the governor's office is working on a multi-level housing initiative to ensure that behavioral health and housing. It's a big initiative. I was at a kickoff event last week and got to chat with her a bit. So if you've been in contact with Amy Whitfield, I'm not sure she would be a good person to talk to. But for the council to hear more about that, it might be, if the council would like to, maybe we can invite the governor's office as well to talk about housing at some point. So just wanted to put that out there.
We had a representative there as well last week, and Amy is who the governor appointed to our commission most recently. We originally had the governor's general counsel, but now Amy Whitfield is assigned. But I'm really, like I said, I think it's a huge issue, and I'm so glad that they had the summit, and I hope we find out about more resources, because that's the kind of stuff that sadly keeps me up at night is I think we have this great idea about a program, and but we need all of the pieces there for it to work. And like I said, the housing is the one that, and honestly, some of the other resources too, but the housing to me is the biggest challenge. And I'm really glad that there was that discussion last week. And I just hope for something, especially with justice involved individuals. I know, I do recognize that they have pending cases, and probably if there's enough work out there that folks don't necessarily need to provide services to them to keep their job, but we're not going to resolve the problem if they don't get the treatment they need, if they don't have a roof over their head, and if they don't get the access to the medication that they need. So thank you for being there and whatever work you're doing in it. It's so important.
Thank you. And then Melissa, you originally were up next, but you also said you had some information to update with regard to the jail. So why don't you go ahead and go next?
Well, thanks so much. I think I raised my hand earlier when Justice Zamora and others were speaking about the desperate need for expanded access to treatment in rural communities. And I wanted to clarify that I'm now serving as the State Opioid Treatment Authority, so overseeing the opioid treatment providers across the state, and wanted to just share that the structure is shifting, that our federal partners have greatly rolled back regulation that will enhance our ability to increase access to methadone via mobile units and medication counters and what have you. It's a slow moving boat, right? Because the feds are actually slower than us, if you can imagine. And so, but as soon as these reviews of 42 CFR are approved and promulgated, the primary rule around methadone dispensing and opioid treatment provider process and regulation, we will very quickly move as quickly as we can in a state government scene. But we're going to roll back our state rules as well. So I wanted to just give people a heads up that while it won't be tomorrow or next month, but that the tide has turned, and we certainly are fully committed here in the division and under my authority in the Office of SODA to expand access to treatment in rural communities. So I just kind of wanted to give that heads up. And then the other bit was about expanded access in jails, and I'll give a quick word and then turn it over to Dr. Warwick. But just wanted to advise that, I put in chat another thought just so that you all are aware. I don't know if you're reading chats. I think Dominic is. I know what a skilled facilitator you are. You're tracking it all. That there is some, it's a pittance, but there were a couple of million awarded under opioid settlement, and hopefully more to come to support housing specifically for persons living with opioid use disorder. Rolling
Melissa?
out. Yes.
Oh, there is another question. It's not in the chat. It got texted to me by one of our folks on the phone. Just if that funding is 1 year, or if that's going to be multi-year funding on that RFA for the
really
Fresh Start rental
question.
assistance. Do we not know yet? 1 year to start and hopefully more later?
Yes, it was a part of that opioid settlement stuff that happened in the last moments of the session, right? And so we have every expectation that we know that the opioid settlement dollars are continuing to flow. We know that there will be reconsideration, and we believe that there will be a continued funding. But excellent point, whoever texted. At this point, and it is a great disadvantage, we were given 2 million for 12 months, which means really 2 million for 8 months, because it takes 4 months to get money out of a state agency and into the hands of our partners who do the work. Thank you, Jennifer.
Oh, yeah, the RFA is out and due on 9/18.
Yeah, I'll find the link and post it in the chat, but I think it came out last week. And I've been working on it. So it doesn't have a time frame. Like, I don't think it says how long. It doesn't even have like an amount. I think you just kind of ask for whatever you think you can use.
Okay, well, hopefully
Thank you
this will
so
help.
much.
Oh,
Thank
sorry.
you.
And Melissa, did you have other items? Sorry, I'm trying to just make sure we cover all the points and topics.
Of course. No, of course, Dominic. I could give a minute on expanded access in jails to treatment. Is that something you wanted to have?
Yeah,
now?
I think that's an important thing. Go ahead.
Out of Senate Bill 425 that passed this session, albeit with language limiting it to corrections, BHSD is charged with writing rules that will direct MOUD in state corrections, and rules that will also apply to detention centers. The money, the allocation and the deadlines on rollout of such a program in 425 were directed only to state corrections. But we are working closely. Grace Phillips from New Mexico Association of Counties is on our rules writing committee with an eye toward this rolling out as a mandated through statute, certainly being taken up in the 24 session, but as a 30-day session, unclear that it'll get through. But again, mandated access to treatment in corrections, state corrections has already happened. Mandating access to corrections in detention centers is surely to follow. Certainly also, being driven by the suit. I'm forgetting the name of the great legal organization that has taken that up, but essentially put pressure to bear. And so there's a number of detention centers, MDC among them, making progress that are moving in that direction, being cognizant that it will, that it is going to be mandated in the coming 12 to 24 months. So we will see, it's going to be fits and starts in county detention for sure, because the access to resources is so varied, but certainly in corrections, and that's a big win by the end of fiscal year 24, providing a full range of MOUD, methadone and Suboxone, and perhaps Sublocade, of course. And we're working on the rules now. And there will be a public hearing and a rules review that you all can look forward to. It'd be great to have some of the expert minds on this committee weighing in on our rules. Thank you.
Just as a note, Melissa, if you send the information for that through the Google groups, it'll go out to the entire listserv for the council here. So that would be that's a great resource to get some people involved in that. And then Justice Zamora, I saw you put your hand up real quick.
I did. The presenter's asking questions now. I was wondering, so in the jails in particular, especially in misdemeanors, we have a pretrial detention law, and it doesn't even apply to, you can't really detain someone in a misdemeanor. So if they're in jail just for a couple of nights and they get methadone or even a couple of weeks, is there going to be a way to provide the follow-up on, like, will the jail then say, go to this place as a follow-up for your medication or whatever? Do you know? And I don't know if I'm making any sense. I just know that that's a lot of defendants when they're released from custody. They may, same with their psych meds. I mean, they have their medication and maybe they give them a few for the days that follow, but then there's not follow-up immediate follow-up that then sends them elsewhere to continue on their medication. That was one of the gaps I saw just as a judge. I was just curious
Yes, absolutely. And it's, one of the issues is if what you're doing is coming out of MDC, you have, and you're living in Bernalillo County, there's, 12 different places that you can attempt to enroll to receive methadone. And certainly less so in counties all over the state. I think we have county coverage we have OTPs in exactly 5 counties.
Okay.
So this is a serious issue with regard to treatment with methadone. It's one of the reasons that we want to advance getting mobile units lined up and medication counters, so to speak, so that there's access in smaller communities. Suboxone, as you can imagine, is a much easier lift to provide a referral to a community. And working on that as well. There's been reduced regulation so that video conferencing with a Suboxone provider, such, Dr. Warwick can approve Suboxone delivery in Doñana County if need be. But you raise a huge issue with the difficulty in getting a referral certainly for methadone services.
And I don't know, this is an ignorant question, but I haven't been a trial judge for 5 years, but regardless of medication, they were a bit confused if they'd pay out of pocket, if it was covered, where they went, those kind of things. And I guess all that
that's another.
That's just like someone there to transfer
right.
them, if that makes sense. Like if my primary doctor would refer me elsewhere and say, this is where you need to go, this is what you need to do, and this is how it's covered. They would tell me often, and their attorneys, that's where they would kind of lose. They might stop taking their medication, or might stop going for treatment, or doing whatever. It was that transfer out of custody, that there was a gap. And
right.
Then sometimes they might commit another crime, or, all of the stuff that happens.
So one of the big advances in New Mexico, and it's going to continue to advance, and this definitely is a topic, Dominic, for another council meeting, but I think should be on your, on your screen for future discussion, is the 1115 waiver. So the first thing I wanted to say is that there are provisos in place for Medicaid to cover the services 30 days prior to release, and for reinstatement in Medicaid prior to release from the jail. So that, in reality, it's not a smooth process, but there are policies in place and for Medicaid reimbursement, such that there shouldn't be any hiccups as long as that individual is eligible for Medicaid. The waiver 1115 to the Centers for Medicaid Services, or CMS, will enhance that 30-day window to 90 days, which is going to be a tremendous incentive for jails to know that they can provide services that will be reimbursable by Medicaid. And it's another super wonky, big, long federal application, but it is in the works.
And I hate to interrupt this, but we are starting to run out of time. We do have one other presentation, an update from Haley Peterson here in a few moments. So what I'd actually like to ask is, Melissa, if you don't mind putting your email in the chat, that way Justice Zamora could have that, and you could maybe provide a little bit of additional support offline, if that's helpful. And we do have I see here that Robert has to drop on off. I do understand. We did have a draft recommendation from the Integrated Medicine Subcommittee. So unless there are burning questions or pressing questions, is it okay if we move on to our next presentation at this point? I do see, Brandon, you have your hand up. Do you have a quick question or a point? I know there's so much information, we can't get to all of it all the time.
Yeah, I kind of anticipated this happening. Having been met a couple of times now with Justice Zamora, I really appreciate her coming here. I think the collaboration and the information that she and others are able to do, I think, is a huge asset to the council. Would love to see her come back, and yeah, I've got several comments on our last thing, but we can cover that another time too.
Absolutely. And we really do appreciate it, Justice Zamora. This is fantastic. And I know sometimes it's a little slow going at first, but as you can tell, once it happened, once the first question, the floodgates open. So I think there's probably a lot more, and we would love for you to come back and participate in the future also. Do you have any last words? And we hope you stay for the rest of the meeting as well. I think you'll have
Yes, I
some good
will. This has
information.
been very interesting. I've got a million sticky notes, but just thank you so much for having me. And this has been very informative for me, and I hope we can continue the conversation. So thank you.
You're welcome. And just so everybody knows, in the agenda, I did put the link to the commission's website. And so from there, you can actually see the next meetings. I believe the commission's next meeting is September 29th. And they have a pretty packed agenda. So if you're interested in that, the link is right there within our agenda so that you can get onto that website. So, all right. Thank you again, Justice Zamora. We really appreciate it, and we look forward to speaking more. All right. Haley Peterson. I saw you on earlier, Haley. Are you?
Yeah, I'm still here.
Perfect. Okay. We have so many people on, I can't see everybody on the screen. So if you have a presentation, go on ahead and start sharing. And the floor is yours.
Great. I'm going to leave my camera off while I'm presenting just for the sake of my old laptop. But are you all seeing my full slides?
Yes, it is there.
Okay, great. All right, so yeah, I'm going to go over some of the mortality data and the emergency department data today. I'll try to keep it brief since I know there's a few other agenda items still. But just to start, this is a graph looking at the drug overdose death rates. New Mexico is in blue, the US is in orange. So you can see we've had a long running history of our rate being higher than the national average, but it really starts to climb in particular in 2019 through 2021. So our 2021 is the last year that we have final mortality data, and that drug overdose death rate was 50.6 deaths per 100,000 persons. I do have some provisional data that I can share from 2022 today. Unfortunately, we really don't know when we'll have the final 2022 data. But this graph here is showing you the each point on the graph is a running total of the prior 12 months. So it's a count of overdose deaths. So if you look at the provisional data that's in that blue box at the end of the run there, you can see that perhaps we're seeing a slight plateau in the data. So we're hoping that means we won't see an increase in 2022, but the rate still is quite high. And then this is the same data, but by drug type. So if you look here, the methamphetamine line is in green. We started to see that being increasingly involved in overdose deaths in 2017 through 2019. That started to cause a little bit of an increase in our drug overdose death rate. But then if you look at the fentanyl line in red, towards late fall 2019, we started to see that take off. That matched up with what we were hearing from harm reduction program participants, from what they were telling the harm reduction program that was getting passed to us as well. So we really do start to see deaths due to fentanyl take off in fall of 2019, and then that's been a major driver the last couple of years. And methamphetamine continues to be involved in many overdose deaths as well. And then looking towards the end of the run again in that blue box in our provisional data, we do see that there's been a decline in heroin-involved deaths. So that could be an indicator that, maybe fentanyl is sort of supplanting that supply. We also see a slight uptick in cocaine-related deaths. And it's important to note that these drug types are not mutually exclusive. We do often see polysubstance deaths. And then this is the last graph with provisional data from 2022. And this is just sort of to drive the point home that fentanyl has been the main driver here these last couple of years. So the orange line that's sort of flat running along is our deaths that did not involve any fentanyl. And then the blue line that you see start to take off in 2019 are deaths that involved fentanyl. And again, these do involve other substances, so it's not purely fentanyl deaths, but fentanyl clearly is what's driving our rate to skyrocket. And then this graph here, so we're switching back now to 2021 data. That's what we have final data for, where we can sort of dig in deeper here. But 2021 is going to be in orange, and this is a comparison to 2017. So you can see just the difference here in the most common drugs and overdose death. Just in 5 years, you know, fentanyl and methamphetamine, again, really have been major drivers. And then towards the bottom of the graph, some of the prescription drugs have contributed less to overdose deaths in 2021. And then this graph here is showing you the rate and count by county in New Mexico. So the orange bars are the drug overdose death rates, or age-adjusted death rates. And then the blue bars are showing you the count of overdose deaths. So when you look at the death rate, our highest counties for the drug overdose death rate are Rio Arriba, Socorro, and Sierra. When you look at the total number of overdose deaths, it's no surprise that Bernalillo has the highest number of overdose deaths. That's a major population center for the state. And then this is the drug overdose death rate data, but in a map. You know, a lot of people, including myself, like looking at a map. And so again, Rio Arriba, Socorro, and Sierra are in that very dark sort of brownish color, indicating that they have high drug overdose death rates. And then looking at the drug overdose death rates by age and sex, this is the 2021 data. Males tend to have about double the rate of females for drug overdose death rates. But the age group that we tend to see the highest rates in 2021 was that 35 to 44-year-old age group. And then this is my last slide on the mortality data. This is by race ethnicity, and each bar here in these groupings is representing a different year of data. So this sort of shows you how it's been trending in these different race ethnicity groups. So we've seen increases pretty much across the board. So in 2021, the Asian and Pacific Islander group did see an actual decrease. But American Indians have seen increased rates, Hispanics, whites have all seen increases in drug overdose death rates. But really alarming here, and I know that it's also been seen in some of the national data, is that very dramatic jump for our Black population in 2020 and 2021. So that's probably a group that could use some extra focus in our interventions and public health work. And then I'm going to move on to emergency department visits next. If somebody has a question about the mortality data, I just have a couple more slides. So I'll just go through these real quick. But before I show you the data, I do want to point out that the emergency department visit data is very different from the mortality data. So the deaths by drug type, we get really high quality data from our Office of Medical Investigator here. All unattended deaths get toxicology done. So we are pretty confident in our deaths by drug type. It works differently for the emergency department visits. So what we're pulling here is based on the ICD-10 CM codes that are assigned to the visit. So there can be differences. So it may be that they assign it as an opioid poisoning because Narcan worked and it looked like an opioid poisoning. But they, maybe they didn't ask further or didn't find the more specific code to indicate it was fentanyl. So the trends are important here, but I just want to point out that it's not quite as specific as the mortality data, just so everyone keeps that in mind. So this graph is showing you the number of emergency department visits for total drug overdose in New Mexico, and this is from 2016 through 2022. And when I'm talking about total drug overdose, I mean any ED visit that was related to an opioid, amphetamine, benzodiazepine, or cocaine poisoning. But what's interesting here is that in the provisional death data, what we have right now is it looks like we may have at least seen a plateau in that data, though again, I want to caution it's provisional, but with our final emergency department data, we did see a slight decrease in the number of emergency department visits for drug overdose. So perhaps, those two trends are going together there. And then again, this is by substance type, but I'll caution again that it's not quite as specific as the mortality data, but that all opioids code there, does seem to trend pretty well with what we've seen otherwise. And I think while the synthetic narcotics category would include fentanyl, technically, fentanyl did not get its own separate code until October 2020. I think it would probably be pretty safe to assume that the majority of the opioid poisonings, at least since 2019, have been related to fentanyl. There's just, when a new code is introduced, the uptake of it is not always immediate. So that's something to keep in mind, that it's a little bit harder to piece that out in this data. And that was all I had to share today. I know that someone had requested that I mention xylazine briefly, and the only thing I'll mention about xylazine is that at this point, we have seen it in some deaths previously, but it was in 1 death in 2020, 4 deaths in 2021, and at least in our provisional data for 2022, we've had no deaths where xylazine was identified. So I'll just mention that briefly.
Great, thank you, Haley. Are there questions for Haley? Comments? Oh, there is one in the chat. Haley, do you have an estimate for when the 2022 data will be finalized?
I unfortunately do not. We don't know because there's been some vacancy issues at the department. So I wish we knew.
Okay, thank you. Any other questions? Okay. We have had in the last little bit a couple of people who have joined us. Joanna Katzman, as far as council members, and Leslie Hayes both have joined us, both actually a little while ago, and it was my neglect to have mentioned them earlier. So my apologies on that, but definitely welcome. Are there any other council members that I may have missed that have joined? Nope. Okay. All right. Well, we'll move on then to the next part of our agenda. And if anybody does think of any questions for Haley afterwards, we do have her contact information, and we can definitely get those questions if you either want to send them directly to Haley. And Haley, would you put your email in the chat, or you can send them to me and we'll go there. Oh, Leslie, you have a question?
Yeah, I actually put it in the chat. How often is alcohol involved in the overdoses? Do we know that?
That is something we get in toxicology. I hate to quote a number off the top of my head, but I want to say it ranges from 15 to 20%, but I'll see if I can pull a more specific number, at least in the 2021 data real quick.
Haley, again, thank you for all of the hard work and everything that you do. I like Leslie's question on the alcohol. I think in New Mexico, my understanding is we've led the nation in over 20 years straight with alcohol fatalities. And with that said, alcohol and what's happening with those trends has always been left out of the DOH and on this. And I've got some mixed feelings on adding it. I mean, the council was originally developed and to treat pain and to manage that, and we're slowly moving into an addiction, chasing that more, and that may require more of a discussion philosophically where we as a council go.
Right, and that's definitely something we can talk about a little bit more, Brandon, at our next meeting if we have enough time on our agenda for next time.
Great. This is Philip. Also, there were some slides that I have, I believe, from last year that Jim and Alicia Campbell had put together that was sort of a cross-reference. And she did a line of including alcohol in combination with methamphetamine and fentanyl, and I can find those and reshare those with the group if you're interested. I think that might have been 2020 data.
Yeah, I mean, Phil, you can always send that out through the Google group.
Great.
Yeah. Okay. Any other questions about Haley's presentation? Or the information? Comments? Okay, well, we'll move forward to our next items on the agenda. Now, we do only have about 20 minutes left. So I do know we do have one recommendation from the Integrative Medicine Subcommittee. So I'm just going to ask really quickly from the other two subcommittees, do we have new information or new updates that we need to go over at this time?
A little bit, but I can wait to see if we have time afterwards.
Okay, thank you, Phil. So if there's no objections, why don't we move over to Michael Pridham and the Integrative Subcommittee. And Michael, I'll bring up that the document here in just a moment. So
Perfect. Thank you, Dominic. So I'm Michael Pridham. I'm a chiropractic physician, chair of this Integrative Medicine Committee, and we've been working on trying to obtain some rural tax credits for integrative medicine providers. And we came across some issues in the legislature due to no reporting of integrative medicine practitioners in the healthcare workforce training document or workforce document. So I started looking into that, and the Health Sciences Center at UNM is charged with doing the reporting about different provider groups. So we were able to meet as a committee with the interim Vice Chancellor, Dr. Hangame Racy, and some of her colleagues. And we discussed the different issues with the document and found out that there had been a breach in the regulations and licensing board's data collection of all the license providers. Whenever we renew our licenses, we fill out that survey that says kind of information about how many patients we're taking, if we're seeing patients in different areas. And we found that the last 2 years, I guess, have been pretty much stolen. So we kind of discussed what some of the problems were from HSC's viewpoint and what they recommended. And that what I'd like to recommend is that the governor's office create a comprehensive center that would be established to track the number of medical providers in the state, including integrative medicine practitioners, people that prevent opioids in the first place, and that this will help retain and recruit providers, that it'll help better track the providers throughout the state, and that that's mainly what the recommendation is. So I had asked her if she could attend a meeting, so we'll invite her to the next one once we establish the time, so that she can, if need to, answer any questions.
And just so everybody is aware, this is the draft recommendation. There's still a little bit of work that needs to be done on it to flesh it out. And Michael and I were talking about it earlier. So what we're doing is we're just introducing it here, so everybody has a chance to start looking at it. We'll get it posted up to the website here in the next couple of business days for this draft. And then we'll continue, and the subcommittee will continue working on it to get it a little bit more finalized and get it set and ready for consideration at our next meeting. And then perhaps we also can have, it's the chancellor, correct, Michael?
The vice chancellor, but
Vice chancellor.
we could invite the chancellor as well. Yeah,
So
thank you
are there-
for working with me on that.
Absolutely. And so are there questions for Michael with regard to this and sort of the direction it's going?
I've been working with the legislature as my okay, let's see. Would this affect all licensed providers? Yes. And it's so all licensed providers have to fill out this survey already. And then they just haven't been reporting about all of them because there hasn't been any funding for it. And so we're working on that.
This is Philip. Can you elaborate a little bit on when you say 2 years of data was essentially stolen, or 2 years of information?
So I had asked originally if they could just add in information about chiropractic physicians, doctors of Oriental medicine, other integrative providers, and they said, well, actually, all of the survey information from the regulations and licensing department had been, there was a breach and it was all stolen. So we don't have the last 2 years. So I don't know how that happened, and apparently they don't either.
And just so that everybody knows, this was something that happened towards the end of 2022, where there was this data breach. It actually made national news, and so it's something that's been going on. And just even in our work, we get a lot of questions from providers we work with about, well, if I have to register in the system, is my data safe? And so there's lots of ongoing questions and concerns regarding that. I do know that RLD is doing their best to ensure these sort of things do not happen again. But I think that this is something that it's really just expressing the desire and the wish to ensure that that does not happen again and increase that security. Okay.
Well, I think that's all I had.
Okay, well, thank you, Michael. Any other questions? Anything else? Okay, let's go to Phil. Phil, for your updates.
Hi, everyone. Don't have any specific updates to, we had changed the name of the subcommittee from the fentanyl subcommittee after a couple of years to emerging threats. Been keeping a close eye on that all this year, and so far, as has historically been the case with New Mexico, we seem to be somewhat shielded from some of the crises that we see unfolding in other places. Number one mainly being xylazine. As you heard Haley mention, there doesn't appear to be any in the data. And back in, I believe it was May, I attended a presentation by two of the folks associated with the Office of the Medical Investigator that presented to the statewide epidemiological outcomes work group. And one of them said in that meeting, and I asked for clarification when they were done speaking, that they were not seeing anything in the data to match all of the information that happened to be on the news, the local news and stuff at that time about that. So pending nothing new and knowing we had a short session, have elected didn't think it was necessary to call a group together, but the update is actually that I have changed roles since the last time we all met, and I'm no longer with the Mountain Center up north. I accepted the position of technical advisor for the adultery checking program here in the state, and so that is, we are in the process of implementing, putting some mass spectrometer technology paired with our harm reduction programs here in the state so that we can start monitoring the drug supply. Things are moving very quickly with that. We've ordered our first couple of Fourier transform infrared mass spectrometers. We're hoping to have 2 programs set up with that heading into the new year. If people are interested, though, since the passage of House Bill 52 last year, which, by the way, I wanted to add that 2 years ago, the council, one of our recommendations was to implement advanced drug checking in the state. So it is in the process of unfolding. The Mountain Center, New Mexico Harm Reduction Collaborative, and now a few others have been taking advantage of mass spectrometer advanced drug checking program with the University of North Carolina. And we now have a quite a good body of data looking at drugs everywhere from Raton and Rio Arriba County, Santa Fe County, and Bernalillo County. And if people are interested in actually seeing that and taking a look at those, looking at that and having a discussion about it, I would be happy to schedule a meeting.
Okay, thank you, Phil. Do we have questions about that? And I just want to say, it really is great to see some of the recommendations from the council. I know sometimes we don't always have the best follow-up to say what kind of an impact have some of these recommendations had. And I think that especially in the last year and a half to 2 years, we're seeing that with almost all of the recommendations that we're making are moving into either policy phase or even have been funded through various means. And so this one, I think, is a really important one, and we've pushed for it for quite a few years. Recommendation, even though the recommendation was 2 years ago, we've been talking about this even longer. So this is great to see, and thank you, Phil, for taking that job.
I saw enough nods on the screens. I can see that I will. I'll put out a poll to see if we can find a date, and then we can take an hour and go through all those results that we have.
Great. All right. Thank you, Phil. Okay. Anybody have any other questions, comments for Phil? Okay. And so we don't have anything with regard to our third subcommittee on methamphetamine, any additional updates at the moment. So we'll go ahead and move on to other business. So are there other items that have come up recently for the council's attention?
This is Philip again. Just one of the, it's funny in harm reduction, sometimes you say some things like it's good news and not everybody hears it as the good news that it is. But so far, all of the methamphetamine that we've had tested in New Mexico is basically pure methamphetamine. I'm also the co-author on a paper that has been accepted for publication that'll be available soon, looking at the presence of primarily fentanyl contamination in stimulants from around the country, and have found that it's practically non-existent, regardless of what you are reading in the news or potentially hearing from folks. So more information to come on that as well.
Great. Thank you, Phil. Okay. Anything else? All right. Well, with that, we move on to our next meeting. And so at this point, we normally, or we have been with the exception of the summer meeting each month. And so that would put us into November. And so the one issue there is we're usually doing the second Friday of the month. And November 10th, which would be that day, is Veterans Day being observed by the state. So I would recommend, unless there's an objection, that we move our November meeting to Friday, November 17th at 1:30 p.m. or starting at 1:30. Will that work? Or would people rather move it? I'll start with the 17th. If there are objections, then I would say we would check on the Friday, November 3rd, which would be 7 weeks from now rather than 9. But let's start with the 17th. Are there any objections on the 17th of November? Okay, I'm seeing a lot of head nods that it'll be okay, that it's good. Thank you, Phil, in the chat. All right, so we will schedule it for November 17th. And so with that, thank you, everybody. Thank you to our guests, especially to Justice Zamora and to Haley. Thank you for the presentation. And thank you to everybody else who is here. I did neglect at the beginning of the meeting just to, as a normal reminder, that we don't introduce everybody, because what we really found was in years past, we would spend half an hour to 45 minutes with everybody introducing themselves and not actually get to the work. So we had decided to have moved to just a roll call. But for those people who have joined into the meeting, you will be included in the attendance. I'll actually just pull it down from Teams directly. So you will be included. We thank you. If anybody, and especially if it's your first time being here on the council meeting, if you have questions or anything to go with that, you can go ahead and reach out to me. And if you've joined through the Google groups, you already have my email and a way to message me through there. But I will also put my email address in the chat so that people have it. And otherwise, with that, thank you to everybody. And I hope that you all have a great rest of Friday and a great weekend. And until we see you again next time.
Bye, everybody. Have a great weekend.
So long.